record. All right, and then if everyone could just say that quick, I agree to be recorded, maybe in that same alphabetical order so we can practice before we do introductions.
I agree to be recorded. This is Tegan.
I agree to be recorded. This is Sirry.
I agree to be recorded. This is Laura.
This is Tim. I agree to be recorded.
This is Wayne. I agree to be recorded.
This is Jael. I agree to be recorded.
Awesome. Thanks, everyone. And then if we could just try to probably mute in between when you're not talking, just to make sure we're not getting any weird feedback, that'd also be great. And then we'll just wait until maybe a couple minutes after time, and then we'll get started. I'm going to turn off my video and my sound. Good luck, everyone.
Anyway, see what you can figure out. I've been unmuted. Thank you. Hello. Am I?
Hello.
Do we have audio here?
Very fine on my end.
Okay, great. Hi, I'm Sofia Vinogradov, and I have the wonderful pleasure of introducing you all, but I haven't been made. There we go. Good. All right. This is so you can see a face going along with the voice, the disembodied voice that's speaking to you. Thank you all for coming. I'm have the privilege of introducing you and then stepping into the background and letting Tegan and Alyssa and Donovan take it from there. But I wanted to get a chance to say a quick hello before we get started.
Hello, and thanks for inviting us.
No, it's wonderful to have you all.
Sounds like we're expected to have a good turnout. It's exciting.
Yeah. Well, there's 61 people on right now.
Fantastic.
Yeah. Let's give it just maybe one more minute. I see people are still entering, and then we will take it away. Sound all right? Okay.
Sounds good.
Yeah, sometimes with our new Zoom lives, things get smushed back to back. And we've got a nice hello from Katie, who's also been involved. All right, let's go ahead and get started. Good morning, everyone. Thank you for joining us for this special panel today. We have over 70 people who have joined us. And I think probably many of you know me, but let me introduce myself. I'm Sofia Vinogradov. I'm the department head for the Department of Psychiatry and Behavioral Sciences. And it's quite exciting to be able to kind of introduce this special event. And the timing of it in the month of August is really kind of consistent with something we've been doing in the department for several years, which we have had often in the summer events, whether it's a special reading or book club event, or whether it's some kind of, again, special panel discussions that are hosted by our Diversity and Inclusion Committee. So to have this panel happening at this time of year, time of where we can reflect and think about how we want to enter the new academic year, what goals we want to set for ourselves. Again, the timing is really fortuitous. This special panel was organized by a number of people. I have to really give credit to Alyssa Krueger, Donovan Roediger, and then also Katie Lingris and Scott Crow from our impact and well-being sector played a role in supporting this. And then, of course, I would especially like to thank Tegan Carr, who is graciously agreed to kind of lead and moderate this panel. And Tegan has the experience both of what it is like to do research in our department, had been a research coordinator with Dr. Bond, if I'm not mistaken, and now is a medical student. And I hear through the grapevine has an interest in psychiatry, which of course couldn't please me more. So I'm going to turn it over to you, Tegan, and let you take it away from here and give the official title for our panel and introduce our speakers. So thank you all for being here, and I look forward to a very stimulating event.
Thank you, Sophia. Yes, my name is Tegan Carr. I am currently, as Sophia mentioned, a medical student with the University of Minnesota. I was a full-time member of the psychiatry department from 2016 to 2019 and professionally affiliated with the department since 2014. I continue to participate in the psychiatry department's diversity, equity, and inclusion initiatives, and I currently serve the medical student body as Chief Diversity Officer. And thank you to everybody who is joining us today and who submitted questions. I'd like to actually turn it over and have our panelists introduce themselves. And if we can do that in alphabetical order, please.
Okay, I guess I'm first. My name is Laura Abrams, and I am professor and chair in the Department of Social Welfare at the UCLA Luskin School of Public Affairs. My area of academic specialty is juvenile and criminal justice, and in particular, looking at ways to decarcerate and safely provide alternatives to incarceration. And one of the reasons that I've been interested in this topic is in recently thinking about ways to transfer and divest funds from policing and reinvest into social services. And so I've been involved in a number of conversations in the social work profession on the larger scale about what it means to safely reinvest in social services rather than policing. And thank you for having me.
My name is Sirry Alang, and I am an associate professor of sociology and health medicine and society at Lehigh University. I am interested in mental health and structural racism, and I think about police brutality as one of the oldest indicators of structural racism. And so I'm interested in being part of a conversation that connects mental health and policing. And thank you so much for having me.
I'm Tim Black. I'm the director of consulting for Whitebird Clinic and the Cahoots program. I started working with Whitebird Clinic on the Cahoots van as a crisis worker in 2010. Spent several years working full-time doing those responses before moving into an administrative role where I was the operations coordinator, which meant that I was responsible for all of the logistics of really delivering this service that we've been talking about in so many different settings lately. My focus now with Whitebird Clinic is helping other communities explore the Cahoots model and evaluate whether and how to implement that service into their community. Most recently, we've been doing a lot of work in California, especially in Los Angeles County. But there's also been a lot of activity that's been happening in New York City and a couple of different communities up in Canada that have been really taking a close look at this. Earlier this summer, we also saw the launch of Denver's STAR program, which is modeled after Cahoots. And this year also marks the first anniversary of implementation of the Crisis Response Unit in Olympia, Washington, which was another program that we helped develop. So I'm really excited to be here today with such an incredible panel of experts to really engage in some meaningful conversation.
So good afternoon, and my name is Wayne Harris. First, thank you for inviting me to attend this panel. I look forward to our discussion. I am a retired Deputy Chief of Police from the city of Rochester, New York, and currently I serve on the Board of Directors for the Law Enforcement Action Partnership and also as a national speaker for LEAP. I'm also a member of NOBLE, the National Organization of Black Law Enforcement Executives. And I guess I was selected by LEAP to take part in this because since my retirement, I have begun a consultancy designed to facilitate the conversations similar to what we're going to experience today, how to engage the community as law enforcement, how to engage communities that we serve, also how to educate communities on the truths about law enforcement, and also to see if we can figure out some of the negative dynamics that are occurring here in our country. So I very much look forward to this conversation, and again, thank you for inviting me.
Thank you. Hello, everyone. My name is Jael Kerandi. I'm an undergraduate student at the University of Minnesota, studying finance and marketing at the Carlson School. And I just recently wrapped up my term as the undergraduate student body president. And in that role, I asked our university to sever its ties with the Minneapolis Police Department and start to really look into the racist and very murderous actions of that department and how that does not align with our institution, and how Black students and students of color have often been asking for an understanding and to be kept safe on these campuses, and as tuition-paying students, that they have to see actions that align with diversity and inclusion as such as what their university professes. So very happy to be here today on this panel.
Okay, I think that is everybody. Thank you so much for giving your introductions. A couple of things I'd like to go over before we get started. I have a few different types of questions here. I have some that were submitted by members of the department, hopefully who are viewing right now. I have some that were written by the organizers of this panel. And then we also will be receiving inquiries coming in through the chat and through the through some other mediums. And the organizers of the panel will be screening through those and then communicating them to me. I will be prioritizing the questions that were submitted ahead of time by members of the department. So it's possible we might not get to all the questions. I do ask everybody to please be considerate of time. And I'd also like to say the purpose of this is to have productive and constructive and much needed conversation. This isn't a debate. My role as the moderator is really to make sure that we stick to the time frame and direct the questions properly. All right, does anybody have anything they'd like to add before we get started? All right, so we will begin with our first topic, and that is the state of policing in the United States. And we have 15 minutes for this topic. We have, looks like 4 questions for this. All right, the first submitted question is for Wayne. What police reform initiatives are currently underway, and how effective do you feel they have been or will be moving forward?
Also, there are a number of police reforms that are being suggested by many law enforcement organizations around the country right now, NOBLE being one of them, LEAP being one of them, and those recommendations have been sent to the Department of Justice. But qualified immunity would be one of them, canceling qualified immunity for police officers across the country for those that are involved in incidents of misconduct or abuse. Also preventing officers from moving from one department to another to escape or to erase perhaps some misconduct in their past. Most of the organizations believe that, eventually we have to get to the point where we are holding officers responsible for their actions, and it's time to start moving in that direction. Now, there are a number of other considerations, for example, the chokehold, the tactics that were used on George Floyd, almost exclusively across the board. Law enforcement organizations and agencies have determined that anything from the neck up that has the possibility of creating death should not be used unless an officer is facing deadly physical force. And as far as the law is concerned, most of the laws on the books in the United States with regard to deadly physical force reflect that an officer will be authorized to use it if they're meeting deadly physical force or if it's imminent for either themselves or a third person. So understanding that anything from the neck up, which can very readily stop the flow of breath and create death, we feel that's a use of deadly physical force that should only be used when an officer is in jeopardy or another person is in jeopardy of deadly physical force being used.
Thank you. The next question is for Sirry. Sirry, you've written on systemic racism in policing. Would you describe some of the history going back to the roots of US policing and put into context the racial disparities that we see in modern policing?
Yeah, so thank you so much for that question. It's always important to look at the origins of modern policing and policing force that stemmed from slave patrols. These were individuals that were paid for by the institution of slavery, of American slavery, to ensure that enslaved Africans would not flee. And some members of slave patrols were also young white men who volunteered, were unpaid, decided that they would take upon themselves the task to arrest, to monitor, to stop and ask questions, even to enslaved people who had been freed, to demand identification. So some of the ways in which we see our policing operating are really similar and consistent with how with how slave patrols operated in history. And so that context of Black people being stopped and asked questions, of Black people, being prevented from gathering, from Black people, being prevented from living in particular neighborhoods, interrogated when they are still in neighborhoods that aren't perceived to be disproportionately Black neighborhoods, are consistent with the history of this country. And so the whole idea of policing or police institutions being racist doesn't just occur in a vacuum. It occurs within the context of US history, and looking at that history and thinking about how our modern day police forces can really engage with that history and understand that they have criminalized just the bodies of Black people, the freedoms of Black people is really important. And I think that police reform should occur within that context of addressing that mistrust and that fear of police institutions.
Thank you, Sirry. Jael, this question is for you. You were a key influencer in the removal of MPD from the University of Minnesota's campus. There is no doubt that this was warranted, but could you offer some insight into what ultimately empowered you to make this move? And what do you think about UMPD's presence on campus despite MPD's removal and student calls for divestment?
So in regards to, I think, the empowerment portion, I think it's important to note that activists and people who have been calling for the divestment or calling for us to really examine the policing state has happened for years, right? Like, I was not the pioneer of this by any sorts. What we hadn't seen per se is that we had seen administrations really responding to this. And that's what happened here at the University of Minnesota. In terms of what empowered me, one, I saw a situation on our campus as a first-year student where we had very aggressive police force, where we continuously saw the police treating students of color very wrongfully. And I asked many times for administration, what are we going to do about this situation? What are we going to do about the students that feel unsafe? Like Dr. Sirry has just mentioned here, it's not necessarily about the objective idea that we have a police that therefore we're safe. It's, do you trust the safety measure that's been put into place? Do you trust the metric or the what is there to be safe for you? And if that does not exist, then you aren't truly safe, right? The reason you trust the safety of a fence is because whatever's on the other side, you're assuming that fence is going to protect you from it. And what students had been telling me was the very people that were supposed to be protecting us, we felt like we needed protection from. And when you have that tension, you have that instance there, we had to speak up for students. And after we saw the murder of George Floyd, that didn't happen in another state, it didn't happen in another place, and it wasn't a few years ago. This is happening right now. And it was happening in the city of Minneapolis, and our university had a responsibility to respond to that in a way that showed Black students that Black lives mattered on their campus. In regards to the UMPD, and the same thing holds. We have to examine that department, and we have to look into the actions that they have had. Something I've also been trying to ask about for years, and ask into how can we, if this is the relationship, or if this is the body that is to be on campus that is going to protect Black students, and they aren't doing that, when do we listen to the needs of Black students and say, how has this changed? And some of the responses turned into donut hours or community engagement. Well, if I don't trust you, I don't want to also be in a room with you. I don't also want to sit down and tell you about my problems. So the continuous conversation that needs to happen with the UMPD and the divestment from resources needs to be looked into. How do we then re-engage our Black students and our brown students and start to give resources into mental health? How do we start making sure we have Black mental health professionals of color? How do we make sure that our students are coming here and they aren't leaving with us with more debt than their white counterpart? How do we make sure that we're recruiting properly? How do we make sure we're not implementing things of redlining and healthcare policies that are racist? So for me, what it looks into is look into how much money we're investing into policing and what the outcome is. Those are very disproportionate. So what do you do to support students and let them know that their tuition dollars are getting their return on service?
Thank you, Jael. And Wayne, we have another question for you. By some accounts, the Minneapolis PD is a fairly progressive department in that officers already receive mandatory implicit bias training, use of force training, and crisis intervention training. However, police encounters with Black citizens are 7 times more likely to involve the use of force than those with white citizens. Is racism in policing a problem that can be solved with more or better training, in your opinion?
So actually, that's a very, very good question. First, let me thank Dr. Alang for her response earlier, because it's important for us to understand the history of law enforcement. And, you know, the very simple answer to your question is, of course, racism exists in law enforcement, as it exists in banking, as it exists in mortgage lending, as it exists in education. Consider that the law enforcement industry had its birth and has grown up through its infancy in some of the most racially divided times in the United States history. And for the, you know, the simple fact is, as to Dr. Lang referenced, they at one point were used as, you know, slave catchers for those, you know, African Americans that had decided they no longer wanted to live in bondage. You know, the precursor of law enforcement was directed to set upon them and return them back to bondage. So, you know, certainly that is something that we need to understand if we're going to move forward and actually correct not only behavior that we're seeing, but also the relationship between law enforcement and the community. So to answer your question with regard to, is it possible to train out of this? I think so. In fact, I taught implicit bias training prior to my retirement from the department. I think it's a component to beginning to solve this equation. The training of, you know, making sure police officers know and are very familiar with the neighborhoods that they're serving, making sure that we're hiring properly, making sure that the testing that we're doing to, you know, recruit people into the ranks of the law enforcement industry, it's very, very critically important that we get that right. But it's also necessary for us to understand that, well, 2 things. One, there are men and women behind those uniforms, and, you know, wearing those uniforms makes it very, very difficult sometimes to see the humanity of a person serving as law enforcement. They're subject to all of the different emotional, psychological and physical traumas that anyone else are. And the simple fact is this: there's not a person on this planet that does this job that walks away from it unscathed. They all carry something with them based on the experiences that they've had while serving in law enforcement. So as we're talking about how we can correct this, training is going to be a component of it, but so is, you know, making sure that throughout the course of their careers, they are physically, emotionally, and psychologically able to continue to serve the community. That's how best to establish a good, healthy relationship. It's how best to establish a healthy department. So it's going to take some effort. I think it's going to take law enforcement agencies across the country to embrace some of the best practices that we know are out there. And for example, I'll direct you to the President's Task Force on 21st Century Policing, the final report on that. That particular report has 156 action items and recommendations for the federal government, municipalities, and law enforcement agencies across the country to how best to, you know, manage policing in the 21st century. And the last pillar of that report has to do with officer wellness. And it understands that in order to do this properly, we have to make sure our officers are well trained. We have to make sure they're prepared for serving in this particular environment, and we have to be honest about it. So yes, in my humble opinion, I do believe that it is possible to train to make sure that we are putting forward the best possible candidates and the best possible officers out there. But I think we need to, you know, take a closer look at exactly what that training looks like to make sure it's appropriate.
Thank you, Wayne. And we are about coming up on time. I did want to use our last 2.5 minutes to open up the floor for other panelists who have anything they would like to add on any of the topics we've already discussed, or any of the questions that have been answered. And I see that Dr. Sirry has her hand raised. So Dr. Sirry, if you'd like to take it over.
Yeah, I'm just going to really acknowledge Wayne's point about the importance of training, but also to say that training in and of itself, you know, I appreciate that training is a component, but I don't think that we can train ourselves out of racism. I think that it's more institutional, and so we really have to think about how our laws and policies facilitate, you know, police violence. For example, the fact that entire neighborhoods that are disproportionately Black and brown and poor neighborhoods are typically, you know, crime spots. They are labeled as crime spots. And that those neighborhoods are over-policed, for example, for substance use. Whereas in our dorms, in our predominantly white institutions, where a lot of illegal substance dealing happens, those places are not policed, and neighborhoods are not policed.
Looks like we had a disruption, maybe in Siri's signal. I do see that Laura's hand is raised. We have about 1 minute left.
Okay.
Go ahead.
Yeah, I just wanted to support what Sirry is saying, that, you know, decades of evidence and experimental designs in the research have showed that implicit bias training does not reduce use of force against Black people. And so I just want to ensure that we take the conversation out of the individual and toward the systems level, because, you know, with all due respect, officers we know they don't go into this in order to perpetuate violence upon people. But at the same time, the institution of policing itself creates a culture where officers feel that they can do what they wish with their weapons with impunity. And so we can't train our way out of that legally. We can't train our way out of the institution of institutional violence. So issues of over surveillance of Black and brown communities, issues of the culture of policing they weigh more heavily on those outcomes than individual well-being or implicit bias in the research literature. Thank you.
For that. And we're at time, so we are going to be moving on to our next section here. This section is mental health and police violence. Again, we have 15 minutes for this section. All right, Dr. Sirry, this is for you. Can you touch on your recent publication titled Police Brutality and Mistrust in Medical Institutions? How does police brutality interact with the medical system, and more specifically, what impact does police brutality have on mental health at the community level?
Okay, so I'll start with the last part of the question. How police brutality affects mental health. I think it's a catch-22. I think the research that we've done shows that police brutality, and this is not just the police being violent, it is the police action that's unconscious, but that dehumanizes. It has effects on people's mental health. It increases rates of anxiety, especially among Black men. There's a recent study published in the American Journal of Public Health by Dr. Lisa Bolek and colleagues. So just the anticipation of police brutality increases mental health symptoms. So range of mental health symptoms from psychological distress, post-traumatic stress disorder to suicidal ideation. And so police brutality increases symptoms of mental health. But we also know that people with mental illnesses are over-policed. They are disproportionately policed. They are disproportionately victims of police violence. In fact, in 2016 and 2017, 1 in 4 people who were killed by the police were people who were in the middle of emotional and mental health crisis. And so we see that it's a catch-22. And so that is important. The first part of the question around police brutality and mistrust in medical institutions really just demonstrates how systemic racism works. I think we have to understand, and I think Wayne talked about it, that the racism that we see in policing is not only in policing. It's systematic in that if I experience police violence, and if I do not trust the police, I'm not also going to trust, any authority figure. I'm not also going to trust the medical institutions. And our medical institutions disproportionately have more police officers there in the name of safety. Studies have shown that Black patients and patients of color are more likely to have the police called on them and their family members and their friends visiting them in the hospital where they are supposed to be safe and protected. So things like that increase mistrust, right? So if I experience police violence on my way to the doctor's office, I'm not going to cease from being a Black woman as soon as I start that encounter with the police. That same dehumanization of who I am as a Black woman plays out in my relationship with a healthcare provider. And so it's not just about the police, dealing with police violence and racism. All of our institutions, our educational institutions, our medical institutions, really have to contend with the same white supremacy that plays out in policing. It plays out in our institutions. And I think that our experiences don't occur in a vacuum. And so addressing systemic racism, we can't just isolate and treat police violence and say, oh my God, we are done. I think we have to work with all of our systems that serve disproportionately affected populations.
Thank you. All right, this next question is for Tim. Tim, you've worked on the front lines responding to active mental health crises. How does Cahoots ensure the safety of both the crisis responders and the individual experiencing a crisis? Do you think that alternative responders are more effective in de-escalation than uniformed police? Why or why not?
That is a fantastic question. And I think to really talk about the safety of the patient interactions that Cahoots team have in the field, we have to really start by just looking at how that response is initiated. What somebody sees when the Cahoots van first rolls up on scene. Our vans don't look like traditional public safety vehicles. They're a big white, they're just a big white van. They don't look like a police car. They don't look like an ambulance. Our responders wear a t-shirt and jeans. We try to look more like the community that we're trying to serve. We recognize that the simple act of wearing a uniform, having that badge, having a gun, a taser, pepper spray, just the presence of those tools to escalate force can impact how an interaction plays out. And we want to present to the individuals that we're serving that this is going to be a safe interaction. So we don't carry weapons. We don't carry that pepper spray. We don't bring with us those means of escalation. We rely on verbal de-escalation and voluntary services to really maintain safe interactions with our patients. I think in part because of our relationship with the community, folks know that when Cahoots is showing up, the objective is to really work with that individual, meet them where they're at, and really provide the least intervention necessary so that we can stabilize and support somebody, but we're not going to spend all night really working on solving every single problem. That's going to be too big of a bite for someone to take at 3 in the morning. So we're just going to really work with them on what's going on in that immediate moment. You know, we handle 24,000 calls for service annually. And last year, we only had 150 code 3 recovery requests. That's 0.5% of our calls, resulting in us needing lights and sirens police cover to come and support us because something became unsafe in that situation. And I really think that, you know, going beyond just the visuals of our responders, I think the other thing that keeps us so safe is how much time we put into our training around situational awareness, around verbal de-escalation and compassionate communication. You know, as Wayne mentioned, CIT officers, or, you know, officers who go through the CIT program are receiving about 40 hours of class time. And that's a great start. Our Kahoot staff go through 500 hours of field training and 40 hours of class time before they go out into the field. And all of that field training, all of that classroom time is around de-escalation, scene safety, and assessment skills. You know, it's not about, you know, there's not enforcement. There's not, you know, a whole litany of different responses that these folks have to be trained to handle. We're really looking at just taking the behavioral health first response calls off the plate. And I think because of that focus, because of the presence that we have on scene, and the services that we offer, that we're able to really maintain such a safe program.
Thank you, Tim. Wayne, this question is for you. A large percentage of lethal force incidents involve someone in a mental health crisis or with untreated mental illness. Can you comment on the training that officers receive to identify and respond to mental health crises? What has and has not worked to minimize the potential for violence in these situations?
Certainly, and that's a great question. I'm extremely happy that we're having this conversation. And before I get to, you know, the training that officers are receiving right now, I just want to commend Tim and the Cahoots program. Rochester actually had a program very similar to it a number of years ago, way back when I first began my career. We called it Entry to Care, and it was exactly what Cahoots is, where someone not, or a group not affiliated with the police department, they could be requested by the police department, but not affiliated with the police department, would be called for individuals in you know, mental health crisis, homelessness situations, public intoxication issues, where, you know, it wasn't necessary for a law enforcement officer in full regalia to go and actually be the person to interact with that person. So unfortunately, what's occurred in a number of areas across the country, and before I get to the real answer to your question, I just want to clarify this one point. Programs like Cahoots, like Entry to Care, are brilliant, and they're critically important to the welfare and the health of a community. What's occurred, though, is that municipalities have had a difficult time maintaining the funding for programs like that. And I'm not sure how Cahoots is funded. I'm praying that they're actually funded in such a degree that they can remain. But when New York State had programs like this, when the city of Rochester had programs like this, two things happened. Number one, our homelessness population began to blossom and increase, and it began to overload their particular functioning, their capacity for addressing some of the people out there. And then the funding was pulled. And what typically happens is when the funding is pulled, it reverts back to law enforcement. So as we're considering as a group and as a nation, as we're considering reimagining law enforcement, we have to get to the point where municipalities begin to think about how to permanently fund programs like Cahoots to make sure that it doesn't revert back to law enforcement and place uniformed police officers in a situation where they're going to have to address, you know, people that are in mental health crisis. Now, you know, Tegan, to answer your question, the reality is the percentage of incidents regarding people in mental health crisis that become violent are very, very slim. And that's actually why, if we're talking about reimagining law enforcement and certain responsibilities we can pull from police agencies and uniformed, personnel, people in mental health crisis is probably an excellent place to start, because it's generally not necessary to send a uniformed officer. And part of the reason they do is because of those very small percentages of incidents that do turn violent. Now, some of the training that law enforcement, Tim's not wrong. Officers get a very minimum amount of training in a recruit or an academy experience to make sure they're certified to be police officers. And that's done because, municipalities and governments around the country recognize that law enforcement will come into contact with people in mental health crisis, and officers need to be at least, reasonably trained to, at the very least, recognize a person in mental health crisis. There's also the responsibility, or at least the authority for mental hygiene arrest, where if a person is deemed to be a danger to themselves or another person, a police officer does have the authority to take that person to the hospital for physical and psychological evaluation. And it's generally, kept for a 72-hour period of time. But there are municipalities around the country, there are agencies around the country that recognize that more was needed. Rochester Police Department happened to be one of them. So a number of years ago, we started a unit within our organization called EDPRT, stood for Emotionally Disturbed Person Response Team. These were a number of officers that were more specifically trained to recognize people in mental health crisis. They were given the tools to address people in mental health crisis, and generally were the ones dispatched out if the 911 call was specific to say that there was a person in mental health crisis. The other way they could become involved is if the initial responding officer recognized, or at least had a belief that the person was in mental health crisis, they could then request an EDPRT member to respond to more specifically and probably efficiently manage that particular situation. So I think
we have about 15 seconds left for this
okay,
question.
sorry. But it's important, and I think this is a topic that we really ought to start, diving into and doing a deep dive just to make sure we understand it properly. So thanks. I'd be more than happy to have further conversation with you about that.
Thank you. Dr. Laura, your work focuses on improving the well-being of young adults with a history of incarceration. What is your view of the juvenile justice system in the United States, and what effect do you think it has on the youth that interact with it?
Well, that's a big question, but we're currently in a state where juvenile justice reform has occurred faster than adult criminal justice reform. So people may not know that that the juvenile justice system population, the census, is at least down by half since 20 years ago. And people may not know that state juvenile justice facilities are closing, large institutions. Reformists and advocates have worked tirelessly to try to roll back the kind of the harsh penalties of the 1990s that led to things like transfer to adult courts and prisons, and harsh life penalties for youth and young people. So juvenile justice system, however, despite the kind of the decarceration angle, and is still really targets Black and brown young men, especially in terms of policing. And so, despite the retrenchment of juvenile justice and the reach of the system, we still have an issue with over-policing and harsh penalties for youth of color. And that remains. So overall, that's kind of where we are in terms of juvenile justice. It's definitely part of this larger conversation. And despite our best efforts to provide mental health and other services to young people in conflict with the law, we still haven't reached a point where youth necessarily get better, so to speak, when they're involved in the juvenile justice system. Hope that helps.
Thank you. And we have just over a minute left. I will open it up to anybody who would like to comment on what we've already discussed in this topic.
I was just going to mention very quickly, when we look at the news and we're looking at the images that are placed in the media right now, my biggest fear honestly comes from the trauma that our students and our young children are going to experience with normalizing some of these images and in thinking that this is somewhat of the norm. There's this fear that children are watching the TV and seeing these violent images and start to create this relationship that seems normal to them, that seems like it's just the status quo, and it shouldn't be. And when I think of the trauma that I've experienced from Trayvon Martin, to George Floyd, Jamar Clark, and the list goes on, and we talk about humanity, I also want us to realize who's seen the humanity in us, who saw the humanity in Breonna Taylor, right? So when we're talking about humanity and we're talking about what we need to do, there's so much trauma that's going to be left with our children right now of these images and these things that are in the media that we're experiencing because it's become dehumanizing. And something Angela Rye said that was really important was, you know, this country promises these 3 liberties of life, liberty, and the pursuit of happiness, and we're still stuck at life. We're still fighting for our mere existence. And that is absolutely, when you look at that, when you're talking about humanity and you're talking about, I am fighting for my mere existence to live. And that in itself can be very traumatic.
Thank you, Jael. And we are right at time. We'll be moving on to the next topic now. This topic is alternatives to policing. All right, and this question is general. So preferred answer, jump in. All right, what are your thoughts on these contrasting arguments? One being that the MPD is fully corrupt and in need of overhaul, and the other argument following the few bad apples narrative.
I'll start. I don't know about the Minnesota PD in particular, although I did live in Minnesota for 5 years, by the way, when I was an assistant professor back in 2000. Let me start by saying that the few bad apples argument is, we're over it. It's time to move on. Okay. We cannot, again, reform our way with soft, quote unquote, reforms out of policing. We've tried that. That's been going on for a very long time. Bad apple argument is like saying, you know, okay, yeah, we're going to remove the 2 bad apples from the refrigerator and everything's going to be fresh. That's just not a viable argument anymore. We have here one of the most liberal police departments in the country, and yet still George Floyd was murdered by 4 trained officers. So, you know, if we continue on that line, I think we're still going to hit brick walls. This is going to happen over and over again. So I'm hoping that through all this public dialogue and discourse, that we can move beyond the bad apple argument. Thank you.
So may I chime in here for a moment, please? I'm going to respectfully disagree to some degree with Dr. Abrams. And I want to put this in perspective because about a month and a half ago, I actually participated in a podcast debate with Councilwoman Alondra Cano from Minneapolis. And it was based on the idea that it was time to abolish the Minneapolis Police Department or begin to defund the Minneapolis Police Department. But there's a reality that I want us to recognize here. Statistically, and please let me qualify this by saying that perception is 100% reality. And perception is going to be what we begin to talk about as a nation. But statistically, There are over 18,000 police departments in the United States and just under 1 million police officers that serve every single day, which translates to millions of interactions that occur between law enforcement and communities every single day, and only a fraction of which ever become physical, and even smaller still could ever be construed to be negative. Now, that's a hard, cold fact. That's the truth. But one of the things that, I hope I pronounced your name correctly, Jael, mentioned a moment ago, was that the media paints an image and paints a picture that is traumatizing this entire community, this entire nation, based on the images that we see. And if we're going to start fixing this, we eventually have to start talking about the counter narrative, which would be the positive interactions that occur between law enforcement and the communities that we serve every single day. Now, taking a look at Minneapolis.
Wayne. I'd like to actually move on to the next question,
okay.
Since we are a little short on time and we've covered this just a little bit. All right, I am actually going to bring up a question that was in the chat. And I would like to, again, just go ahead and jump in if you'd like to answer this, but priority please to people who have not spoken in a little while. All right. This question here. How do police unions play into systemic racism, especially when a police union is run by a when a police union is run by a white supremacist? And we'll direct this question to Dr. Sirry.
I don't know why you're directing this question to me, but I'm gonna just say that police unions, I'm gonna, honestly say that I think police unions should be disbanded and abolished and gotten rid of. I really do. And I think part of that is because, or maybe even, I don't know, maybe reorganize to have, it cannot be, the police cannot decide when they are wrong and decide the kinds of punishment. There has to be a level of accountability. And I think that police unions really play into the blue code of silence that has caused police officers to continue to implement or to continue to, inflict violence in communities and not held responsible. I mean, we can think about the line of people that, and just the ones that have made it to the morning news, the public cases of policing, that unions have played a significant role in that there isn't any justice, and any semblance of justice for family members is public opinion. It's us going on the streets to protest. Without the police unions cannot hold the police accountable. We need to reimagine another system where community members can hold the police accountable, that I think is responsive to taxpayer dollars. And so I fundamentally think that police unions should be disbanded. And I think that resources should be divested significantly from the police and reinvested in other services that serve populations that are disproportionately policed. People of color, people who are poor, people with mental health problems.
Thank you, Sirry. And regarding that question, I'd like to know, Jael, if you have anything to add. We haven't heard from you in a few minutes.
The only thing I will say, and this is a bit in response to what Wayne said about maybe the police having these positive interactions day to day, does that then justify the millions or the many lives that have been taken of Black people? Then does that justify, when did life become the transaction that is made that then justifies the positive interactions that the police may or may not be having, right? So for me, I get very worried about this, like Dr. Sirry has just mentioned about this. We get to decide when we're wrong and we get to decide when we're right. And what we have as citizens is to just deal with it, right? We just have to sit back. And I think what the people are saying is no longer are we going to sit by and allow this to happen, because it's not about the good cop, or bad apples. How many cops are bystanders? How many cops that you are saying that are rightfully trained per se stood by and watched these actions happen and didn't stop their colleague? So So to me, again, we have to go back to the argument that Dr. Abrams has made. This is systemic. This is the institution of policing. You have to look at it not as this one individual has done this, but whether where it's rooted and what actions they believe are justified and are allowed to happen because they can. So in terms of the unions, again, and how they're organized, what we're seeing right now still is this ability that they have that almost seems that they're above what is to be right or wrong. They have the ability right now to determine their own morality. And the people who are paying tax dollars into this have no bearing right now on what that looks like. So we can't use that to say that, oh, you have a positive action, therefore it justifies that a Black person was killed. George Floyd was murdered. Breonna Taylor was murdered. Tamar Rice, Jamar Clark, Alton Sterling. We can go on, and these things are happening. Therefore, if we just sit here and say, well, every other day has been positive, that's just not okay. And Black people are no longer tolerating that, as everyone else shouldn't either, because it should no longer stand that way.
Thank you, Jael. And Wayne, I do want to give you the opportunity to give your input on this question as well. And I will just ask you to, we'll keep it to 1.5 minutes, please.
So, well, very simply, I'm glad Jael said that, because as I mentioned before, perception is reality, and that's the reality that we have to address. So it would take me longer than 1.5 minutes to really have a great conversation about unions. They serve a purpose. Contrary to what Dr. Lang said, they will never hold a police officer responsible for anything, because unions serve two purposes. One, to make sure that officers are able to actually enjoy a decent quality of life, because historically they were never ever paid well until they began to unionize. And secondly, is to defend officers, from misconduct, and that becomes their singular focus. So I agree with her that the community needs to hold law enforcement responsible, and I think the unions need to, and I won't be popular with my union friends for saying this, but I think the unions need to reevaluate the way they are addressing the way they manage or defend for police misconduct. And by the way, Joe, please, I was never ever, and I have never ever tried to justify, the violence that has occurred from law enforcement to communities, predominantly communities of color. I was simply trying to contrast how many interactions that go on. So I'll save the rest of my statements for the closing of this whole thing.
Thank you. All right, and briefly, Tim or Dr. Laura, do you have anything you'd like to add?
I think the one thing that came up for me kind of early on in this specific component of the discussion is, looking at the full scope of the volume of police interactions that are happening on a daily basis that aren't making the news because there isn't that report of the negative outcome. And for me, the question that is raised is why officers are the first responders for so many of those situations. Why is it that across the US we have millions of people who are coming into contact with police officers day in and day out? And that's really, what I'm hoping comes out of not just this conversation, but the millions of other ones that we need to have every day, is to really look at, why is it that enforcement has become our de facto response when we see things that trigger white fragility, when we're confronted with the realities of living in the fallout of late stage capitalism. And that's, yeah. Why is it that the police are the ones that we fall back on every time there's an issue in the community?
Yeah, and let me just kind of piggyback on that comment. When I think about when the defunding conversation started, and I live in a white predominant middle class suburb, and many of my friends and family members are, well, what happens if we defund, and where does that, and I'm like, well, we always feel safe from the police. We feel safe. Everyone should feel safe. Everyone should feel safe. Not trusting the government actors to keep you safe results in a trauma that white folks cannot imagine. And so I feel very strongly that if we are to divest from law enforcement, not bloat those budgets, not continue to protect officers from impunity, that we can reimagine a public safety and a social welfare system that works for everybody and not just white people, not just people like me. And I feel that it's my duty and responsibility as a social welfare professor to find solutions that work for all communities, not just mine.
Thank you, Laura. And I have another question that is for you specifically. You recently co-authored an open letter that emphasized that social workers are not the magic ingredient to eradicating racism in law enforcement. What would you say to those proposing this model? You know, I wonder if maybe this should say opposing this model.
Opposing the social work model, or
Looks
what
like
did you mean? Sorry.
There's a note coming in here.
Sure.
All right, how about we'll come back to that one, and if somebody wants to make additions to it, they can do that. All right, Jael, this is for you.
Okay.
Can you speak to what you think reinvestment of MPD and UMPD funds on campus might look like in an ideal world? How can we best support our students when it comes to safety and policing on campus?
Absolutely. I think this is a tremendous question, and I think one that I've talked about quite a few times in terms of how are students of color supported on our campuses. And this can be in a plethora of ways, and this list is in no way exhaustive. But when you're looking at what safety options that students need. When you look at crime on campuses and you come back with the numbers of what crime has existed in which you would have needed an officer, those numbers are very disproportionate to the number of officers that we have. So that's the first thing to examine. The second thing I would urge us to really look at is how are we getting mental health and professionals of color to our campuses? The trauma that students of color are experiencing, specifically Black students, is one that I think is best served when they have somebody sitting in front of them that looks like them. And this doesn't just mean getting them to our campus, it also means retaining them. The third thing I would say is professors and faculty of color that are on tenured track. And I specifically say tenured track because they need to be retained and they need to be supported in their research, and they need to be able to stay on our campuses so that students see somebody in the classroom that means something to them, that provides a learning experience. If investments in the university are looking to go back further, this can go all the way back to K through 12, and looking at how universities are properly looking into how redlining has disproportionately affected how students are learning, therefore continues to push the resources in high school that really stagnates that growth to be able to come to college based on testing and other metrics. So I think universities as research institutions, as members of wanting to better the society, can do a plethora of things that really invest in that. In regards to safety, this really has to go back to looking into what the students want and need. Does the student want to be walked to class? Does the student want to know that they're going to be safe from something? And if they feel like they need protection, what's an additional place they can go to that is not the police, that is not an enforcement member, that can still provide that safety? Now, we talk about reimagination because we haven't seen it yet. We don't know what it's going to look like yet. But our universities and institutions have to be intentional about finding these metrics in ways that support the community from the community.
Thank you. And Dr. Laura, I believe that I've received some clarification. Let's see if this question makes sense.
Sure.
Okay, so regarding your open letter, and I'll share the quote again, you emphasize that social workers are not the magic ingredient to eradicating racism in law enforcement. What would you say to those who disagree with that statement, who do emphasize the role of social workers?
Well, I think, so my colleague and I, Dean Detlef from Houston, we wrote this open letter in the context of social work being kind of touted as, you know, if we just have social workers alongside police officers, like everything will become better, so to speak. And what we were trying to point out is that social work, as a predominantly white institution, has had its own problems with racism, in particular in the child welfare system and mental health. and have become in some ways part of the surveillance structure of Black and Brown communities, particularly when it comes to families and removing children from homes. And so while my colleague and I fully support reinvestment into social services and community services, and by the way, social work is always defunded, and we don't have union protection, and we are public servants. So I think that's something else we need to look at structurally, is that most social workers don't have union protection. But back to the main point, is that we think social work should be the ones to respond to many of the crises that currently police don't feel prepared to respond to. But we want social work to also look at our own racism within our profession and what we can do better.
Thank you. All right, we only have about 2 minutes left for this topic, but I would like to open up the floor again for anybody to jump in and add any comments to any of the questions that have come up in the last 20 minutes.
Can I actually just sort of piggyback on what Dr. Abrams was just saying? Unfortunately, she's 100% right that, well, two things. One, they do need union protection. And two, unfortunately, they're very, very quick to have their funding cut. We have an organization within the Rochester Police Department called FACET. It's an acronym for Family and Crisis Intervention Team. And they are actually dispatched when the call that comes in to the 911 center is very apparent on its face that it's going to be something that has to do with more of a social service than actually a law enforcement issue. So I'm glad we're talking about that. I think they're critically important. They do happen to work very, very well with us. It's a partnership we've had for a number of years now.
Thank you. And Tim, I see you have your hand up. We have a minute left. Go for it.
Yeah, so crisis emerges when a need goes unmet. And so when we're talking about this idea of who's responding to these crises, we also need to look at why these crises are allowed to emerge and then escalate. And so, I think it's totally right to say that social workers instead of police is not the answer in every situation, because we're completely ignoring everything that's been going on to allow that crisis to unfold in the community. It's only when we start to really look at things like violence interruption, community mediation, access to basic needs, low barrier shelter, the ability to interact with your community and be perceived as a neighbor and, be valued for your presence, regardless of whether you have four walls and a roof. If we're not addressing those underlying issues, we are always going to be in this reactive state. We are always going to be talking about who the right responder is. We really, as long as we're looking at this level of reform and looking at these systems, we need to really understand how these systems are impacting the community and where that failure of those systems is creating these crises and creating these opportunities for marginalized and oppressed populations to be forced to have these interactions with law enforcement.
Thank you, Tim. We are at time. We'll be moving on to the next topic. And this is our closing topic. And once we get through this, we will have a little bit of time to go over some of the other questions that have come through over the last hour. This topic is, what can and should the mental health field do? The first question is general. Anyone who would like to answer it can go ahead and jump in. As a department focused on mental health, what would you like to see? How would you like to see us participate in the conversation on reimagining policing? In other words, what is the most impactful work that mental health faculty, staff, and learners can engage in at the present moment?
I'm gonna go first, and this is general, not specific to mental health, but in some ways it is. I think that the conversation around police violence and depolicing mental health, I think it's easy for every sector of the society to put that burden on the police. I think it's wrong. I think every single department, every single sector needs to think about why that violence exists to begin with. And Tim said that perfectly. I think we need to think about psychiatrists, social workers, therapists, we need to think about how we can address structural inequalities that produce. The police is not there to address the symptoms of structural inequality. A call for domestic violence, a call for somebody walking around suspiciously, a call for a homeless person. Those are symptoms of structural inequality. And we have to think about that. And specific to mental health, I think that our mental health institutions should reckon with the fact that they have historically criminalized the behaviors of Black people. And that is something that mental health institutions, psychiatrists need to wrestle with and think about what mental health means to Black people and to people of color, and to address that history, and to think about ways of building trust with communities that have had their symptoms criminalized by our mental health systems.
Thank you. Any other thoughts? Go ahead,
Yeah.
Dr. Laura.
I think it's really important for mental health professionals and our training programs to start to encourage and incentivize more students of color to come to our programs, to receive training, funding and fellowships and recruitment and admissions. All of that needs to be examined. If we continue to have a mental health workforce that is mostly white and mostly women, I don't think we're going to adequately meet the needs for prevention and intervention that we currently have in this country. So, a lot of social work programs are very diverse. And I don't know as much about psychiatry, but we need to have more funding from the universities at the chancellor's level to provide avenues for more students of color, and particularly Black students, to become mental health professionals at this time.
Thank you. And I'd like to move on to the next question. And again, this is not directed at anyone in particular. Our department, that is the Department of Psychiatry, interacts with the security and 911 when it comes to safety concerns for our patients and participants. How can we be more thoughtful about how we interact with these forms of policing?
I think that when you call the police, that the patient, when the first responder, who's a police officer, comes into a situation and I'm in crisis and the police is called, when the police comes and doesn't talk to me first and it's talking to whoever called the police, I'm already mistrustful of whoever called the police, including the police. I think that, if you can avoid not calling the police, that's fine. But I think if you call the police, I think you want to create a level of trust that you want people to communicate what their issues are with the police. Don't take the voice of a person in crisis and speak for them, because that creates that. To me, that means that you're going to listen to whatever. When the police comes to me, they've already had a picture of the story from whoever called them. That I would feel unheard as an individual. The second thing that I want to stick as a person who's done research on mental health, and especially mental health in Black communities, is that nothing stigmatizes mental illness more than police presence in a crisis. It just sends a terrible response that if I have a crisis, if people find out that I have a crisis, that it's going to be the police. It just creates stigma, and it might escalate the distress. So I know that to some degree, people, they can't help but calling 911. But I think it's left for whoever called 911 to talk to a person in crisis and create some rapport, and not have that be a disconnect between, then that mistrust from the police then transfers to you as a person providing mental health services, and the whole thing just gets escalated. I just think it's a really fine line to navigate. And I would always say, like Tim said, that we should be asking, why even call 911? What are some of the alternatives of people that are trained to do that doesn't escalate the issue and then doesn't create more mistrust and more stigma around mental illnesses?
Thank you. I'd like to move on to the next one. Again, this is general, and this is something we have touched on already, so I will ask anybody who responds to this to please try to avoid anything that we've repeated in the interest of time. What roles can we as mental health professionals and members of a psychiatry department play in particular in advancing an anti-racist agenda?
I can start. We've recently, and I'm chair of our department in social welfare, and I know that by no means is any department or academic institution not influenced by the larger structures of institutional racism that permeate institutions of higher education. But I think in our own ways, we have to really look at several issues within higher education. So what we've done as a faculty is we've worked with the Black Caucus students to arrive at kind of a set of agreements moving forward. And this is about, who's in our program, funding, admissions, climate, curriculum. So we're trying to address anti-Blackness and racism at many different levels. So even if we can't necessarily change, the chancellor's office is UCLA, or we can't necessarily change something larger than us, I think we all have a responsibility to participate in action in the arenas that we can make a difference. So whether that's departments, schools, colleges, kind of tackling the institutional layers of anti-Blackness and racism is very important at all these levels.
Thank you. And if anybody else would like to chime in?
Yeah, I was just going to say for individuals, if you're looking for how you can make sure something is anti-racist, is be anti-racist yourself, right? And going through the journey of understanding what it means to be anti-racist, going through the journey of understanding privilege, understanding systemic racism, understanding what these roots are that are in our system. And then once you have that understanding, I think some people think this journey happens in a few months and I'm here and I get it and I'm done, right? It's a continuous tension that you're battling with because of the norms of what you've been taught and what you've believed to be true. And then once you have that, for those who have the power of hiring, firing, or authority, that is your job then, if that is a value you hold, and in the space that you're in, you want that value to exist as well, to also look at and make sure you're implementing those policies across the board, which would mean hiring people who are anti-racist and talking with those that need to find a different opportunity if they are not.
Thank you for your response to that.
I just want to add that, just real quick, I just so appreciate, Jael, what you're saying, and hope maybe you'll become a social worker, but okay. Beyond that, there's a role for everyone. I don't think that we can't rely as white folks on people of color to tell us what to do at this juncture. I think especially Black people at this time are tired of having to tell white people what to do. As a white administrator, I know I get that feedback from my faculty of color, from students of color. I've taken that to heart. And what I've done is try to put forth an anti-racist agenda to do the work, to do the reading, to do the self-work. It's never finished. I can never call myself anti-racist. But, we have to also know that we have a role to play as white people who are in positions of power. And so I feel honored to do this work. I'm not necessarily speaking as a role model for anyone, but I know that I have a role to play. And I'm trying. So that's all.
Thank you. And I have a question. This is a general question. So this is regarding the use of crisis intervention techniques used by mental health professionals, particularly techniques that involve physical restraint. What impact could the use of such techniques have on the development of children of color, particularly male children of color, in terms of their role in society and their relationship, the relationship or the interaction of between their physical body and authority?
I'm going to address really briefly. I haven't studied this, but I was a group home worker where physical restraints were used. My first job with young people under age 13 to 18. And I think for the most part, in my personal experience, that using physical restraints for mental health crises for children was largely unnecessary. And we were trained to do it because we were afraid. It is an overused technique in residential and juvenile justice facilities because people are fearful, but it has a detrimental effect both on children and the people who have to carry out those duties, who are largely like me. I was 22, undertrained, and told this is what I had to do, and it was traumatic.
Thank you, Dr. Laura. I'd like to open it up for somebody else to add anything to this question, and then I will offer a little bit more clarification. So this is, I believe, so regarding more of the socialization of children of color. So what kind of impact can this have, this use of authority, this use of physical restraint, this physical interaction with their person by an individual with authority? What impact can that have on their development in our society?
I think one thing that comes to mind is really what are we demonstrating when we say, when we reach out for help, right? We've called because there's something going on, and that response, that help, is physical restraint. What we're teaching is that reaching out for help is dangerous. When we're allowing responses to occur where physical restraint can be the outcome or is intended to be your primary response. Similar to Laura, my career started with, more of a residential setting doing wilderness therapy. And again, being 23, told that restraint was what you had to do. I think about what it was like for me as the provider to be, the restrainer. And if it was traumatic enough for me that I thought, that it lingered with me for a couple of days, what was that experience like for that young person that I had in that hold? And with opportunity to reflect with additional training, what I see now in those experiences of when I was, in my early 20s doing that work, was that I was missing the, half dozen cues that this was moving towards that direction of escalation. I wasn't paying attention to how that young person was eating that day, whether or not they were withdrawn from their peers. All myriad factors go into a situation escalating. And that's why with Cahoots, we spend so much time in our training of de-escalation and situational awareness, because we have opportunities when we're engaging with young people, especially to demonstrate that this can be a safe place to express that emotional content, to have that, visceral response to the world that you live in. And we have an obligation to really empower folks to express that response. And it's up to us to really make sure that we're providing platforms for that expression. And that means really paying attention to those earlier cues and trying to find ways to also validate, that experience.
Thank you, Tim. I'm being prompted to move on. All right, so we have run out of time for this section. We'll move on to Q&A. So at this time, I'd like to encourage anybody who's listening in to go ahead and submit any questions that you might have. We'll go ahead and start with the questions that we have already received. All right, this is for Dr. Sirry and Dr. Laura. For many, the pathway to mental health care starts with an encounter with the criminal justice system. Especially in communities of color, this seems to perpetuate mistrust in institutions of mental health and reinforce racial disparities in access to mental health services. As a result, mental health providers are seen by some as part of the same oppressive system as law enforcement. How can we as a field move away from this and build trust in communities of color?
Did this person read a paper that I published in Health Services Research? It's literally exactly what how this mistrust starts. Well, I think one of the first things to do is to really encourage, I'm an advocate for structural competency training, especially in medical schools, in health professional schools. And it's really about acknowledging the importance of structure and its implications. Right, so it acknowledges that clinicians need the skills to be able, just as much as they need the skills to be able to treat patients, they also need to really be trained on how to understand and analyze how social and economic determinants, how racial inequities and white supremacy, how all of these factors outside of the healthcare system shape illness outside of the clinical encounter to begin with, even before the exam room. And I think that training on structural competency is really important. And I think that a lot of medical schools and clinical schools talk about it, but it's not. I have looked at the curriculum, medical school curriculum that's standardized. Very few medical schools engage in structural competency training. Some of them have one semester of it. I think as much as you care about diagnosing the clinical problems, care about being able to identify, diagnose, intervene, and advocate for structural changes that matter for your patients, even before they enter the clinical encounter.
Thank you. Dr. Laura, do you have anything to add since this question was directed to you as well?
Can you repeat it briefly? I'm sorry.
Sure. For many, the pathway to mental health care starts with an encounter with the criminal justice system. The result is that mental health providers are seen by some as part of the same oppressive system as law enforcement. And how can we as a field move away from this and work to build trust in communities of color?
I have one very simple response. Thank you for rereading. Jails should no longer be our largest provider of mental health services in this country. That's it. In other words, how that happened, in Los Angeles County, we have a jail system that is our largest mental health provider in the nation. It's called Twin Towers Correctional Facility. People are chained to their cells and they're, chained to their beds. There's coercive treatment. They come in through the homelessness area. They go out back into the streets. So we have a revolving door of mental health, homeless service, and jails. Of course, there's no trust there. Of course, there's no trust. We have to restore a community-based mental health system that is not rooted in jails. That is the, I think it has to start with that structure, and other things can fall into place from there.
Question with the police officer. We'll go ahead and continue with that. Any thoughts from our panelists?
I think we didn't hear you for a minute, Tegan.
Oh, okay. Let me go ahead and repeat here. Okay, can you hear me? All right, thank you. Okay, this person would like to hear perspectives on what can be done in an evidence-based way to reverse militarization and patrol car only disengagement from the community. In their experience, they have never once had a casual interaction with a police officer. It's always just been an anonymous force from inside tinted windows.
So I'll chime in on that, and very simply, shame on the chief or executive officer of that particular agency that has not directed and developed engagement strategies for their personnel to engage with the community. And what we've found is that when it's simply an officer driving up and down a street in a car with or without tinted windows, there is no engagement. There's no opportunity to develop a relationship. And relationships are critically important for the health of the community that we serve. So I'm sorry, but whoever that police agency is or that police department is, they're wrong. They need to develop strategies to get their officers out of the car, walking their neighborhoods, beginning and establishing relationships with not only the community, but the businesses and everyone else.
Thank you, Wayne. All right. Does anybody have anything they want to add briefly to that? We do have a couple other questions. Okay. What is the role of academic, medical, and research institutions to defund and dismantle MPD?
Not specific to MPD, but in terms of the larger conversation on defunding the police, I think academic institutions and healthcare, academic medical institutions, researchers and healthcare providers have a duty. If part of our job is to improve population health, then we want to be able to gather the evidence to show that, in fact, that if we do defund the police, that leads to gains in population health, and that closes some of the racial inequities that we see in a range of health outcomes. And I think gathering the data and advocating for policy change is important. Clinicians have the advantage of being closer to some of the more specific and intimate details of their patients' lives, and they should be able to tell those stories and advocate for how meaningful it would be for their patients when, if you have a mental health problem, you don't end up in jail, you don't end up in prison. And when people come out incarcerated, that they are able to have the health care or mental health care that they were denied. So I think in terms of documenting evidence, supporting policy and advocating for patients, in terms of showing how it ultimately improves population health and reduces health inequities, I think it's a job that both clinicians and researchers should wholeheartedly engage in.
Thank you, Sirry. And this puts us right at 12:30. Thank you so much for your participation, panelists. We greatly appreciate you offering us your voice in this conversation, and thank you to everyone who submitted questions. I would like to give the opportunity for any of the panelists who would like to stick around and answer some other questions, but it is 12:30, and thank you so much for your time so far, so feel free to go ahead and leave this meeting if you need to.
I want to add my thanks. This panel was an exemplar of, in its own way, of what I hope our whole nation can engage in, which is deep, thoughtful, respectful dialogue across people who have different areas of expertise and different perspectives. And you modeled that. It was almost gave me chills up and down my spine. You, in your own way, were heroes for these times where that is not done enough. So I want to thank each and every one of you for creating this moment of greatness, which I hope we'll be able to all take and ripple out into our lives. Now I have to do a little just let people know, Deputy Chief Harris and I I made a connection. It turns out he is a good colleague of my best friend's brother, who was the chief of police in Rochester. So it was kind of nice to see what a small world it is and how we have these connections sort of throughout the world. So definitely give my regards to James. But I want to thank each and every one of you. It was really excellent, excellent dialogue. And I think having a mingling component now for those who can stay and have more interaction is great. I myself have to sign off, but wonderful. Take care, everyone.
Thank you for hosting us and for, inviting dialogue, because I think it's true. We don't have enough discourse among people who have different perspectives. So it was really, really nice of you to have us.
Yeah, really inspiring. So,
yes, thank you very much. And I will tell Jimmy that that you said hi. If it wasn't for him, I never would have become Deputy Chief of Police. So yeah, he and I walked a long way together.
Yeah, he's a remarkable guy too. All right, take care, everyone. Bye-bye.
Bye.
Thank you.
Yeah, I just wanted to say.
Oh, go ahead, Tim.
I just want to thank you for such an amazing conversation. It's a little bit earlier for me, here on the West Coast, so this has been just an incredible way to get my day started, and looking forward to potentially some opportunities to engage with, other panelists in other settings. So thank you all.
Absolutely. Thank you, Tim.
Thank you all so much for having me. I also have to sign off, but it's been a pleasure speaking with you all. And I think these conversations are so important to have, to hear from professionals and how this really impacts students in our younger generations as well. So thank you so much.
Thank you, Jael. And thank you for your excellent work in the university.
Thank you.
Yeah. I want to add to that. Thank you, Jael. I've been following your work, and I'm really excited for you and for your future.
Thank you. Thank you so much.
Yes,
Have a blessed day.
What is next for you?
What is next? Great question. So right now I'm interning with Microsoft right now. And so we'll see where that takes me. But honestly, what my journey has become of, I think it's where God leads me next and where I'm needed the most. So thank you.
Well, Jael, please do me a favor and don't ever stop doing this part of what you're doing, because your voice is necessary. And I would welcome an opportunity to have a real long conversation with you one day. I think you're great. So.
Sure.
Deputy Harris, also thank you for being here, because it's very important to have people who've had active duty on these type of calls. So I think just that was very nice, and thank you for putting out your perspective.
Yeah, my appreciation to you, Wayne. Thank you for your work that you did when you were on the force. Thank you for continuing to talk right now. I always think that the hardest thing is to be a police officer and to be a person of color on the police force. And so I want to recognize that and thank you for your work.
No, you're very welcome. Thank you. And the work continues. I mean, I may no longer be in uniform, but this is how I'm trying to continue to serve and trying to fix, what is very clearly broken and needs attention. So, and by the way, Tegan, I apologize for being long-winded, but this is a situation, this is a conversation that unfortunately can't ever just be captured in a house period of time. We really, really as a society have to do a deep dive into this. So if we could do a retreat somewhere and spend, a few weeks actually.
Wayne, I think that you cut out at the end of it, but I do want to say no apologies necessary. Thank you so much for all of your input. It's not enough time to have a conversation like this. There's so much that needs to be said, and I hate to cut anybody off. I hope this is the first of many conversations.
Well, please feel free to invite me back. I would be more than happy to jump back on and have a great conversation. Or even better, since I've really always wanted to go to Paisley Park, please invite me to Minnesota, or specifically Minneapolis, and we can have this conversation in person.
Official invitation extended.
Nice to meet you all. Take care.
Thank you, Laura. Thank you so
Bye,
much.
guys.
I'm gonna head out to Tegan. Thank you so much for the moderation, and Donovan and Alyssa. thank you so much for organizing this and for inviting me. It was really a good time, and I appreciate being here.
Absolutely. Sirry, thank you so much.
Yeah, no problem. Bye.
Thank you.